One very interesting thing about WartPeel's history is that it was originally developed for the treatment of plantar warts. Since compounding is at the core of Nucara's business, this pharmacist discussed using these ingredients with many of Nucara's prescribing physicians from multiple specialties. Podiatrists jumped at the opportunity for a better treatment for plantar warts. Anyone who has treated plantar warts can understand why. Plantar warts are very resistant to treatment and have high recurrence rates. Destructive or surgical treatments can cause pain or discomfort for weeks, often leaving patients limping. After treatment, we may want our patient to limit time on their feet, but this is difficult for most patients to do. Conservative treatments rarely work on these tough warts, and patients do not want to wait for the wart to go away on its own because most plantar warts cause pain and discomfort. Once Nucara had initial success with a 5-FU salicylic acid formula, they turned over the work of refining and testing the formula to their sister company, Medcara Pharmaceuticals, which specializes in drug formulation. After multiple reformulations and extensive testing with podiatrists, the final version of WartPeel that we use today was created. Use then slowly spread by word of mouth to other podiatrists and other specialties. WartPeel is an ideal treatment for plantar warts. For one, the treatment times are short, averaging only 1 to 2 weeks. There's little to no pain, and the patient can continue their normal activities. I've had track athletes and mail carriers continue to walk through the entire treatment. Recurrence rates are rare and are usually linked to the patient stopping the treatment too early. WartPeel effectively destroys the wart, but is only strong enough to cause damage to the epidermis, not the underlying dermis. Therefore, most patients don't need any bandaging or aftercare. Here are 3 excellent cases that demonstrate how WartPeel works on plantar warts. The first case is an 80-year-old female. This patient is my mom, so I was able to get a good history. She said she had felt a callus growing slowly for several months and had been putting moleskin on it, but in the past few weeks it seemed to have grown more and become painful. It appears that the callus came first, caused by the constant friction of a poorly fitting shoe. This caused an opening for the wart to infect. Then the small nuisance of a callus became a painful large wart. She has no history of hyperhidrosis, so excessive moisture and sweating didn't play much of a factor here. Any destructive or surgical treatment, regardless of efficacy, in a patient like this could affect their gait, possibly leading to a fall, which is always a danger at this age. Aftercare of a wound caused by wart treatment would be difficult. This part of the foot is not an ideal place for a bandage to stay on, and if the patient lived alone, which my mom does not, but if the patient lived alone, it would be difficult for them to change the bandage. Infection is also a consideration, especially if the patient was diabetic, which my mom is not. I spent a minute or 2 explaining to my father how to put on the WartPeel, and he generously applied it from the top of the wart to the bottom and slightly beyond. Since there are 3 warts that are relatively close together on a thick skin surface, applying the WartPeel to the whole area is acceptable but not necessary. If you were treating, let's say, SKs or flat warts, which were a few millimeters away from each other, it's always better to get pinpoint accuracy application because it's in an area where the skin can get very irritated by the WartPeel, but on a thick skin area it's acceptable with warts this close. Since my dad is 83 and not the most detail-oriented person, I told him this was fine. WartPeel does not need to be applied in a very thick coat, which is what you see in this picture. It is slowly released over time, so a thicker coat will mean a stronger treatment, but also a much longer drying time, and the WartPeel could possibly move off-site while drying, which actually happened here, as you'll see in the next slide. WartPeel is already strong and only needs a thin coat to be applied. It took over 30 minutes for this thick coat of WartPeel to dry. Tape was then applied. When I returned from my weekly visit with my parents, here is what I found. When treating plantar warts, you are used to seeing a well-defined white thick area where the WartPeel was applied. Keep in mind the patient is 80 and the plantar skin has thinned significantly, so the treated wart will look different than the next patient who is in his teens. 7 to 14 days is the recommended treatment time for plantar warts. The patient has completed 6 days, but has significantly thinner skin than the average plantar wart patient, which will speed treatment time. Note the marked area where the WartPeel migrated due to applying it too thick or it was applied below the wart. The plantar surface of the skin is forgiving to over-application or misapplication because it's so thick. Imprecise application to thinner skinned areas, where common warts are, flat warts or SKs, can cause enough pain and irritation that the patient may stop the treatment before the lesion they're treating has resolved. The next step was to perform curettage. I was very careful doing curettage on an 80-year-old woman's foot due to the thin epidermis. The epidermis was easily removed and the patient felt pain when the dermis was reached. There is an entire presentation on determining when to stop WartPeel. This patient had already told me that the pain the warts were causing were gone, clear sign that the wart may be gone. I did what I call the press test, where you start at the adjacent skin to the wart and proceed pressing over the wart to the other side, searching for any remnants of the thick wart. Here there was little difference. Since warts obliterate skin lines, I carefully examined where the warts were and saw that for the most part the skin lines can now be seen running through those areas. The wart is probably gone, but since the area is not painful and the patient only completed 6 days, I advised 2 to 3 more days just to be sure. After 1 week of healing, the area was still pain-free. I performed the press test again and felt no evidence of the wart. There are small erythematous areas where the warts used to be. Since the 5-FU destroys warts much faster than normal skin, the areas where the warts were may look slightly different when healing, as we see here on the patient's thinner geriatric plantar surface. I found WartPeel to be 95% effective in an average of 1 to 2 weeks. But the warts that most commonly recur or don't respond to treatment are severe plantar and palmar warts. Ideally, this patient should be seen several weeks later to make sure there is no recurrence. With proper use of WartPeel, recurrence rates are extremely low. After 2 weeks of healing, the patient continues to be pain-free and the area has healed well. Press test is still negative and skin lines are clearly seen where the wart used to be. It's also a possible sign of the callus reforming. 3 weeks after healing, the skin is back to normal. The patient had no pain, no downtime, no impaired gait, and no wound that needed to be dressed. As I mentioned in some of my other presentations, don't be surprised if more than a few of your WartPeel patients are lost to follow-up. In this case, the patient could have stopped when the pain was gone and the recommended treatment time was over, making the decision that a follow-up wasn't needed. When you first start using WartPeel, you may notice some patients who don't come back for a follow-up. And it's not a bad idea to give them a call. Most of the time you will get a "thank you very, very much, the wart is gone," and you can get some details about their treatment, which will allow you to gain insight into their WartPeel experience and increase your knowledge. Case number 2 is a 15-year-old male with a plantar wart. He had tried over-the-counter freezing twice with no effect. He stated that it was causing a little bit of pain and he could feel it when he walked. Multiple treatment options were discussed and the parent and the patient chose WartPeel. The patient was advised to use WartPeel for about 10 days and then make his follow-up. This is what you typically see on a follow-up for a plantar wart patient 10 days later. The treated area is firm, hard, and white. Plantar warts never spontaneously separate and peel off from the skin. Common warts that are raised on the back of the hand or on the knee for example, frequently do peel off. If the plantar wart is extremely thick, and especially if the patient could not return for follow-up, it's a good idea to have them file the dead wart off as the treatment progresses with a nail file or even a better tool, a cuticle pusher. This allows for the WartPeel to be applied closer to the wart. Even if debridement isn't done, your typical plantar wart, like the one pictured above, can be cured by WartPeel. No additional measures other than just applying it. When curettage was performed, this well-defined wart was pushed inward to the space where the epidermis was separating from the dermis, creating the hole seen in the picture. This is a clear sign that the wart is cured. But since the patient wasn't having any irritation from WartPeel, I gave them my standard advice to use it for another 2 days just to make sure. The patient came back about 20 days later. You can see the outline of the healed area. Now, the patient had come back for a different problem, but you could see that many patients looking at their wart may not see a need for a follow-up at this point and may not actually come in for a follow-up. Case 3 is a mosaic wart on a 14-year-old female. She'd had it frozen at her pediatrician's office and made it clear she did not want to have that treatment again. She estimated the wart was about 1.5 years old. Mosaic warts are less common than your typical plantar warts. They're flatter and more superficial, which should make them easier to treat. However, more often than not, they are large and sprawling, like the one pictured above. This means more surface area to treat, more pain, and a harder recovery. This patient also had mosaic warts covering a significant portion of the ball of the foot and her toes, which were not pictured here. This patient did not come back for their 2-week follow-up as recommended, but came back 3 months later for a different problem. She said she didn't come back because the treatment was working well, the warts were going away, and she had a lot going on at the time. She said she was very happy with the treatment and thankful she did not have to go through freezing again. On close inspection, no further warts can be found. The small brown area, as you see in the picture, is just simply dirt. That concludes our presentation. At Medcara, we believe in standing behind our product and supporting our prescribers to get the best possible results from WartPeel. That's why I'm available to answer questions, to go over cases by phone, text, or email, and I'll respond the same day or the next business day. I can also do a virtual presentation for your office or professional organization. And don't forget about all the educational resources at WartPeel.com. I'm Steve Leon, Physician Assistant, Clinical Consultant for Medcara and WartPeel. Thank you for listening.